study about anti-tubercular drugs, which means TB, tuberculosis. Tuberculosis, as everyone knows about TB, which affects lungs. Tuberculosis is an infection which is caused by MT, which means Mycobacterium tuberculosis. It is the major cause of the death, and it is mostly seen in the HIV patients. Its severity may increase in the patients with diabetes mellitus, chronic renal failure, malnutrition. These patients may effects from lung diseases. Let's talk about the classification, which means the drugs which kills TB. This classification undergoes two types. Type 1, primary line, or we can call as primary generation, which means first generation. Secondary line or second generation. This primary line or primary generation drugs are high effective and less toxic, which means these drugs gives more effects with less toxicity, whereas second generation drugs are low effective and high toxic. Examples of first generation: rifampicin, streptomycin. Examples of second generation: para-amino salicylic acid, fluoroamino phenolines. Mechanism of action of TB, tuberculosis. This is common mechanism of action of tuberculosis. These are mycolic acids, drug isoniazid, drug pyrazinamide, this is RNA polymerase may takes place in mechanism of action. It is a beta subunit. This is which prevents mRNA synthesis and also protein synthesis. Drug rifampicin. Now let's study about side effects of these drugs. It may cause blurred vision, muscle spasm, jaundice, loss of appetite. As we all know, TB may cause shortness of breath. Cough may release. Patients may get dizziness. They may feel restlessness. And gastric stomach related. And let's talk about its uses. These drugs treat latent and active TB and also MAVM complex. MAVM means Mycobacterium avium complex. Now, pharmacokinetics. These drugs are well absorbed orally. These drugs are administered orally. Metabolized in liver and excreted from urine, which crosses placenta. Drug interactions. Absorption may increase in the presence of antacids. Its effectiveness also decreases. These antacids may not given to the patients who suffers from TB because it decreases its effectiveness and do not give any results. Dose 300 mg daily and 1 to 3 doses.